Good afternoon, everyone, and welcome to ASPPH Presents webinar, Mental Health During a Public Health Crisis, Tips for Caring for You and Your Loved One's Well-Being. My name is Hala Madanat. I'm Distinguished Professor and Director of the San Diego School of Public Health. Today, it is my honor to moderate this session. It is a very timely topic. This is Mental Health Month, and it is a time for us during the outbreak for COVID to recognize that many of us have had strong emotions, and we're seeing them in both adults and children, that are affecting our mental health. So we're here today to learn from our panelists about strategies and ways and resources to cope with this current pandemic and answer any questions you may have surrounding your mental health and the mental health of those you love. Managing stress and focusing on our mental health will make all of us stronger and more resilient during these challenging times. Before I introduce our panelists, I would like to give you a sense of how you can ask questions. So at the bottom of your screen, there's a Q&A button. At any point during the webinar, please click on the button and ask your question. And I will later in this webinar, when our panelists are done presenting, go back to these Q&A and the questions you have provided and ask them to our panelists. I want you all to know that the webinar is being recorded and will be available shortly after we conclude the webinar. So to discuss these issues and answer the questions today, it is my honor to introduce our three speakers. First, we have with us Dr. Jennifer Reichard. She's a licensed psychologist and the Director of Counseling and Psychological Services at San Diego State University. She's an expert in mental health, specifically of college students. Her career has focused on adapting research into innovative practices to create well-being for students and others. She's a developer of the eCheck2Go suite of online programs, which empowers students to move towards healthier behavior related to substance abuse. The alcohol eCheck2Go is recommended by the National Institute of Alcohol and Alcoholism and used at over 600 campuses worldwide. She's a member of San Diego State University's Presidential Task Force on Alcohol and Substance Misuse. Dr. Reichard received degrees at George Washington University, California School of Professional Psychology, and trained at the University of Miami School of Medicine. Thank you for being with us. Next, we have Karen Lignon. After a successful career for-profit career, she became dissatisfied with the status quo, and she felt a longing to make a difference in her community and entered the nonprofit world over 20 years ago. Karen initially served at Impact Urban America, an organization which offered affordable housing and employment opportunities to hundreds of families in a marginalized demographic. Then Karen transitioned to an international technology nonprofit where she served as the program director, managing the development of various youth mentoring programs throughout San Diego County. She joined Say San Diego in 2011 as the program manager for the North Central region's alcohol and other drug prevention programs. While Karen has been involved with Live Well San Diego since its inception, she was asked to participate more deeply as the co-chair of the North Central leadership team in 2013 and still faithfully serves in that role. Karen currently works with NAMI San Diego as a training and reporting specialist, as well as prevention specialist on the Youth Opioid Response Project, and was recipient of a Public Health Champion Award from San Diego County in March 2019. Last but not least, we have with us Suzette South Fox, who has worked with San Diego's nonprofit sector for 27 years, with serving organizations such as San Diego's Youth and Community Services, Family Pride Coalition, Planned Parenthood, Being Alive AIDS, and First UU Church of San Diego. She currently serves as Director of Education with the San Diego affiliate of the National Alliance on Mental Health San Diego, She oversees NAMI San Diego Education and outreach-based San Diego County Health and Human Services behavioral health contracts in both adult and older adult and children's system of care, in addition to overseeing statewide workforce development contract, helping individuals with lived experience to work as peer and family support specialists through intensive online training. Southbox also oversees NAMI signature support groups and classes for peers and family members throughout San Diego County, in addition to supporting the Youth Opioid Response Planning Grant to address this crisis from a grassroots perspective. She's not a clinician or psychologist or social worker or legal or law professional. She's a person with lived experience of mental health condition or peer. She's family, having several family members with one or more mental health concerns, and most importantly, she's the parent of a neurodiverse young adult who lives with ASD and serious mental health challenges. She lives in the 1924 built cabin in the wilds of East County, and on very good days can be found in the ocean between the half-mile and quarter-mile marker in La Jolla, and cannot wait for the release of the last of the 2 U's Part 2. Now, I would like to invite Dr. Reichert to begin. Thank you.
Thank you so much, Dr. Madanat. It's great to be here to talk about this really important topic. And as we start out, I just think it's important to talk about what is happening. One of the challenges right now is that we can talk about what it is for now. It's constantly changing. We're always having updates, revised plans, canceled plans, revised again. And this is really, of course, disconcerting in itself. We like to know what is happening. We like to be able to predict what's coming and how things are going to go. And as students, you're really working towards something that has a clear path laid out. You know that if you follow the path and with effort, focus, motivation, you will achieve pretty linear results. And so this is quite different than what you are accustomed to and what all of us are accustomed to. And what most people have experienced in the last 2 months plus is just abrupt displacement without warning, basically. So displacement from living places, from classes, from jobs, from friends, from routines and hobbies, and the list just goes on. And so with that abrupt displacement, that's a very acute situation, and it's crisis. And we may be having sort of shock around what's happening. We may go into action. So being very busy, moving places, going back home, or adjusting to online learning, all kinds of things like that. And then kind of have a sense of disbelief or surreal feelings because it's all happening so fast. So moving out of the crisis into the short term, there can be a lot of grief and fear and just uncertainty and anxiety and loss of social outlets and what we usually go to for our typical coping. And then the longer term adjustment, when the acute sort of becomes chronic, there can be a lot of loss. Like some of you may have experienced a loss of ceremonies, loss of graduation or church gatherings. And then this uncertainty about economic health and job prospects and things like that. You can move on to the next slide. And so most people are familiar with Maslow's hierarchy of needs. And we really, we have, physiological basic needs that are quite important. And so that's sort of the base of the hierarchy is, just food and clothing and shelter and things like that. Before we can sort of move up into other aspects. Now, many of us are used to living in this very top self-actualization or esteem areas, you know, especially people pursuing diplomas and degrees. That's where we live. And as humans, we are at our happiest when we are pursuing goals, meeting goals, and it really works well. But what's happened here in these last couple of months is that we have all been sort of thrown into the bottom of this hierarchy. And so the physiological and safety needs are foremost. And that really, those have to be fulfilled, and those have to be okay before we can learn at our best or be our very best selves. And so this is another way of sort of thinking about what's happening. Next slide. You may be wondering, am I normal? Whatever reactions that you're having, am I normal? And it's really difficult to gauge normal in an unprecedented situation and when we are isolated from a lot of our peers. It's really hard to tell. And then the shifting ground, what we're talking about, this crisis is constantly evolving. We are faced with limited or lack of control, and then uncertainty, and then the changing information, and lots of it. And we are neurologically hardwired for connection. And so to change that all at once, it's hard. And so social distancing is really hard. And on the next slide, you'll see college students were asked the one word that they would use to describe how they feel about their campus closing or going to the virtual environment. And you can see there are so many reactions, sad, safe, stressed, all kinds of reactions on this whole continuum. And some people might be feeling numb or a little apathetic, and they might wonder if that's normal. They might be feeling some relief. They might be feeling like they can catch up on sleep or slow down a little bit. That might induce guilt, because we know how many people are suffering at this time. But this whole range of emotions is just incredibly normal. And so I really want to point that out. Next slide. Why am I so tired? So I'm just staying home all day. You know, I'm not doing much physically. So what's making me feel so tired and sluggish? Well, there are a few factors. There are lots of factors besides what we've just been talking about, but also socializing is really different. And every interaction that you have now is intentional. So we don't have the incidental meetings on the street as much, or the wave as we pass by, or the things that just occur in an effortless way that can really brighten our day or fuel us socially. And we have to make an effort for each one of those if we're staying home and we're locked down. And so there are, I think, some positives to that, and also some negatives. Zoom fatigue is real. You know, a lot of is being written about that now, and how if you're doing a lot of Zoom meetings and things, you'll be very, very tired because of attending to a lot of different stimuli and not being able to have the true eye contact that we rely on to understand social interactions and to make sense of those. And so a lot of us, after a full day of Zoom working, we don't want to Zoom for socializing, and it makes a lot of sense. And so we have to try to figure that out, like how to get our socializing in either a different way or just sort of deal with the Zoom. And the other thing about being tired is that we can have compassion fatigue. And I think a lot of you have probably heard that what we've been saying about we are not all in the same boat, but we're in the same storm. And there are a lot of differences in how we're experiencing this crisis. And you know, the illness and contracting the illness is one way, but then there are a lot of other ways too that this is affecting us disproportionately. And your generation is always considering other people and advocating for equity and concerned with well-being and with mental health of other people. And so that compassion fatigue can also take a toll as well. And as wonderful as it is to have compassion, it's important that we frame what we're doing in a way that is real. And so if you are staying home, you are doing your part, you are helping other people. And so instead of framing something in like, well, all I do is stay home, it's like, no, I'm doing an important part here. And I am protecting the safety of other people and myself and my family. And so if you can really try to frame what you're doing in a way that's meaningful, that will be helpful with that fatigue. And then irritable. Why a lot of people are feeling irritable. So let's think about that, the situation again. So given all that you and the world are experiencing, would you expect to not be impacted and kind of feel the same that you always do? Of course not. And feeling short with others, not yourself, and irritable is not only common, but it's an expected reaction to an unexpected predicament and situation. And so not feeling like yourself is very, very expected. You also might think, well, we're all dealing with this, so why is everyone else doing fine? You might tend to think that you're not and that, you know, something is wrong. But that's just not the case, because we are all dealing with something and you may not see it and you may not know. On the next slide, I want to say a little bit about relationships and quarantine mates. And so you think about, what is your situation? Are you home with families, and in a way that your family has never been at home before for so long and so many hours? Are you with roommates who you may or may not have desired to spend 24 hours a day with? Are you with partners or romantic partners that you may feel like you should be happy to get to spend all day, every day with your chosen person? You may have feelings of guilt if you are not in love with that situation. And then maybe if you're quarantined by yourself, that brings up a whole host of other issues as well. And so all of these situations are not exactly what we've chosen, because we don't expect to be spending every moment in our domiciles. And I think the communication with others is really, really important. Talking about your needs, maybe even writing them down, trying to get space to yourself, I know can be really, really hard, and private space. And so you may need to do a schedule for a bedroom that you have, or the kitchen area or something like that, so that you can get some time that you need. And the more that you can make these explicit, the easier it will be for people to understand. And it's really a time to try to think about the skills that you have in the household and to sort of double down on those. So if there's something that you all enjoy, make time for doing that thing that you enjoy. Think about your strengths. Think about, you know, if you're really good at cleaning a certain section of the house, that may be something you take on, and that may be really helpful, rather than expecting every single person to contribute to that section of the house evenly. So try to get creative and communicative, because this is really, when I talk to students, this has really been a large source of stress. It's like, how do I navigate with the relationships and the interactions with quarantine mates? I'll say a little bit about social media. So we know quite a bit about the impact of social media on our mental health. For example, some of the studies have to do with Facebook. I realize a lot of people don't use Facebook, but I think we can extrapolate from those results. So studies have found that the more time spent on Facebook, the more negative mood and more symptoms of depression and irritability are occurring, and even anxiety. And so I am not here to tell you what kinds of things you should consume. I mean, you must decide that for yourself, but I do want you to have that data in your head so that you can make good decisions, and know that if you don't feel great after having consumed a lot of social media, there's a reason for that. So our brains are hardwired to compare to other people. We don't think in absolutes, we think in relative terms. And so when it comes to things, cars, salaries even, it's not a thing in itself, it's a thing in comparison to other people. And so when we're seeing others present their best selves on social media, then it really pulls for that comparison and feeling like you're just not where you want to be, you're just not good enough, etc. And so there are ways to combat this in the sense of, if there's a certain platform that gives you more joy than others, or if there's a platform where you limit your friends or what you're seeing to just a certain amount of people, that's really helpful. And then also, I know that your generation is very hesitant to block people or unfriend because it seems unkind. But if it's for your mental health, you might want to consider snoozing certain things that you're seeing. It can make a big difference. And you can even take some data for yourself and look at how you feel if you do those types of things. So that's getting into coping, which is the next slide. Anybody found some new ways of coping? I know that we're all being forced to kind of rethink the way that we are dealing with all this uncertainty and things. And one of the most important things is to acknowledge your thoughts and feelings. And that's why I started out the way that I did, talking about the whole range of experiences that could be happening. The first step is really to say, this is how I'm feeling, in order to be able to cope with that certain feeling. So you really want to be able to do that, and do that with another person if you can. Talk about how you're doing, ask how they're doing. And then also, if you find yourself going too far down the road of what ifs and things like that, try to bring yourself back to now. A lot of us have heard of mindfulness activities, and so that's a lot of what bringing us back to now is about. So it's like grounding yourself, feeling your feet, smelling the aromas that are around, getting yourself back in the present moment to prevent us from sort of spiraling with anxiety and from asking ourselves questions that we can't answer. It's been really important for people to regulate their schedules in some way, because a lot of what we're lacking is structure, and the more we can implement that for ourselves, the better, and it will really help sleep as well. And if you can use a mantra like what I started talking about with I'm staying home, and that's helpful, or change negative ones. So if you're thinking, I'm totally unmotivated, if you could change that to I'm okay and I'm safe and I'm doing the best I can, it's going to be way better for your mental health and your productivity if you use self-compassion. And we talked about compassion for others, but a lot of times we don't use that compassion for ourselves, and it can help everything so much. So really listen to yourself and what your thoughts are that come so quickly. And if they are critical, it's not helpful to you really in any way. Another thing is temporal distancing. And so if you think about next summer, I want to do X, Y, or Z, and you can sort of envision where you might be on a beach or something like that. That will help you get out of the uncertainty as well. And then really think about the news you're consuming. So be informed, but not inundated. That news will be there. You can totally catch up. You don't have to have it on all the time. And it might be important for you to take little breaks from updates and news and things like that. And lastly, will we return to normal? So what we know from history is that things don't last forever. This will end. We will get through this, and we will, in a sense, return to normal. I know that a lot of you are hearing the term new normal, and that can be really disconcerting because it sounds like this is forever. But I think what that term is trying to do is get us used to protecting ourselves, and we're in for a longer haul, and that is absolutely true. But yet we will come out the other side, and we know that. So I think that's important in this whole thing, to kind of feel like, okay, yes, we need to develop our new coping skills for right now, but yet we will come out of this pandemic at some point. So I'm going to stop there for now.
Great, thank you. We'll turn it over to, you're on silent. Let's unmute. Thank you.
So sorry about that. I live with dogs, so I try and keep that off. My name is Suzette Southfox. I serve as the Director of Education with the National Alliance on Mental Illness, the San Diego affiliate. Probably most of you have heard of NAMI, so that's where I'm with. We're the largest affiliate in the country, and we've been around for more than 40 years. We have about 95% of our staff are people with lived experience, either peers or family members of individuals with mental health condition. So that said, we do know that conservatively about 1 in 5 in the United States, in the world, actually live with a mental health condition. They will experience a mental health condition. And of these millions of people, only about 2/3 will seek treatment. And for the 1/3 that actually does seek treatment, the average delay between first experiencing a symptom and then seeking assistance can be up to 12 years. It used to be 10 to 11, it's now 12 years. So we're here today to talk a little bit about mental health, the lived experience, and managing all of this. What is mental illness, and what will the world be like after COVID-19? We all have those questions. If I could get the next slide, please. So we do know that mental illnesses are brain conditions, and they affect a person's thinking, their behavior, their feeling, their perception. They can also affect someone's ability to relate to each other and activities of daily living. So we're not going to talk about specific conditions. There are over 290, and they span the range of activities, and in terms of people who develop a mental health condition, it's diverse. Doesn't matter what age, what ethnicity, gender identity, education, socioeconomic status. I like to say that mental health conditions can and do appear from the CEO to the custodian to the child next door. They're very, very common. Research suggests that mental health conditions have many causes. They're not the result of one event. That said, we know that there can be environmental triggers. There's the biochemical processes, brain circuitry, genetics, environment, lifestyle, stress, trauma. Those also can create triggers. What's very important for you to understand and for you to grab from this is everybody will have a different experience, even if they have the same condition. If I live with bipolar disorder and you live with bipolar disorder, our landscape, our experience can be completely different, just as our personalities might be different. Another thing that's really important to know is that recovery is possible. It is possible to live successfully with any mental health condition, participate in your own recovery, and have a fulfilling life. That is very important. And the last thing I want to say that is super important, especially if you love someone who lives with a mental health condition, lowering expectations can be incredibly helpful. Okay, so put that on a sticky. Next slide, please. So before COVID-19, we talk about the 1 in 5 will have a mental health experience. And if you look at the entire population of the United States and you do 1 in 5, what does that actually look like? It looks like France. It's about the same population as France. And if you look at California, where I am, I'm in Southern California, the number of people, 1 in 5, who would be living with a mental health condition, it's the population of Hong Kong. So we're talking a lot of people. Think about the last time you were in a crowd of maybe 1,000 people. Maybe it was a wedding or a concert or a sport event. Look around. You've got 1,000 people with you, and about 69 of those will be experiencing anxiety. About 16 million people. These numbers are about 5 years old. Out of those 1,000 people, depression will be impacting about 181 or 42 million. Bipolar disorder used to be called manic depression. Bipolar disorder affects about 26 folks out of those 1,000 or 6.1 million. And schizophrenia affects about 11 out of 1,000 or 2.4 million. So we see that these are absolutely growing. We do know that people are experiencing, I loved when the doctor was talking about the new norm. I have really mixed feelings about that. As a family member, I do live with people who have mental health conditions. I also do have a mental health condition, and I parent someone who does. I live in a new norm. And once I got into that, it opened up some safety for me to try and navigate my way. So we're all experiencing being numb and overwhelmed, and maybe changes in our activity and appetite and sleep. And how many of us have had a good night's sleep in 2 months? Not many. Physical reactions and that exhaustion. So we're all experiencing that. What we do know from the Kaiser Family Foundation is more than 4 in 10 adults overall feel worry and stress related to the negative impact on their mental health that this sheltering in place has and the coronavirus has. That's up from 32% in early March, so the number is growing, the people who report having worry and stress that's impacting their mental health. I've also seen figures that up to 80% of people who live with a mental health condition say that it's been worsened by this experience. So it's very important to understand that we do have negative experiences. Some folks, the hierarchy of needs at the very bottom where you're looking for safety and that kind of security and that physiological well-being, a lot of folks who are dealing with mental health on a daily basis, we have a lot of real estate down there. Try not to live down there, but that's where it is for a lot of the time. So the negative impacts are everywhere, and being able to take care of that is so very important. If I could have the next slide, please. The questions that we usually hear, particularly from family members, is how do I get my loved one to understand they have a mental health condition? Or how do I get them to take their meds? Or how do I get my family to accept that our loved one really has a serious condition? You can't answer those questions. You can change the questions, and if you do, you will come to a place that will be much more robust and much more supportive. So what you ask actually is, how can I learn everything I possibly can about my loved one's mental health condition? Not how do I get them to admit or understand. Because if you focus on learning what you can, you learn how to pronounce it, you learn about the diagnosis, the treatment, the prognosis, chances are you may learn about something called anosognosia. That's a lack of insight or an unawareness that you live with a mental health condition. And that's part of it. Nearly half the people who live with schizophrenia and about 40% of those who live with bipolar disorder also have anosognosia, which prevents them from seeing that they have a mental health condition. So you change the question. Side effects, medication becomes, how much do I know about treatment and medication and side effects? And then you talk to a pharmacist, you talk to other people, you listen to your loved one. And if you learn those, your answers will come much easier. And then how do you cope with the family and everybody that's on a different page? Communication is the key. It is so important that you learn how to communicate effectively without judgment and really gets everyone on the same page. In fact, if you have a smartphone or a sticky, you want to take some pictures of the next couple of slides. If I might have the next one. This is an important communication tool. It's called LEAP. That stands for Listen, Empathize, Agree, and Partner. The gentleman who developed this was actually part of NAMI and founded the National Family to Family, the Scientific Council, Assertive Community Treatment, In Our Own Voices. He was a real instrument, and he's also not only a clinical psychologist, but a family caregiver who has a loved one who lived with schizophrenia, who's no longer living, and a loved one who lives with bipolar disorder. And he realized after his brother walked out the door, finally saying, "I'm not sick and I don't need help," it was that point that he realized he is never going to win on the strength of his argument. He is going to win on the strength of his relationship. And he rethought everything about how he communicates with his loved one who lives with a mental health challenge. And this is the technique. It's free, it's fairly easy. You listen, you empathize, you agree, and you partner. I use it at home all the time. So that's where you get it. That's the book that he wrote. If you Google or YouTube, or if you get on YouTube and Google Xavier Amador TED Talk, TEDx, you'll find an 18-minute video that will change your life. Absolutely. I'm going to turn it over to Karen. I took up too much time. Next slide, please.
Well, thank you so much, Suzette. Hi, good day, everyone. It's morning here still. It's afternoon for some of you, so good afternoon, good morning, and good day. So my name's Karen. I work at NAMI along with Suzette, and I am identified as a family member. One of my loved ones has a very serious co-occurring condition, which I'm going to talk about in just a minute. But before I talk about that, you might all recognize this gentleman. Dr. Jerome Adams is the Surgeon General of the United States, and I had the distinct pleasure and privilege of meeting him and seeing him speak at a conference here in San Diego last November before COVID that had to do with co-occurring conditions and specifically with opioid misuse. And he said a couple of really interesting things. One thing I learned from him is that he is neither a surgeon nor a general. And so he also has a very great sense of humor and is a marvelous speaker and really well-versed in some of these issues. But he said that people often ask him, what is the most pressing health crisis in the United States today? And like I said, this was pre-COVID. So he said people ask him whether it's sugary drinks, bad diets, diabetes, drug use. And here's what he said. He said that I think the biggest killer in our society is stigma. If we're going to be honest about it, stigma keeps people in the shadows. Stigma keeps people from asking for help or even admitting that they have a problem. And you'll notice that when I'm speaking, I use words like condition and substance misuse rather than a diagnosis or addict or addiction. And the reason for that is because at NAMI, we like to use what we call recovery language and non-stigmatizing language, because stigma is a big killer because it keeps people from treatment. It keeps people in the shadows, just as Dr. Adams said. And so at NAMI, we are really big on stigma busting. Next slide, please. Could I have the next slide? Thanks, great. So I mentioned co-occurring conditions. We know that 43.6 million adults approximately in the United States have had a mental illness or a mental health condition. My slide is not as recovery oriented as I would like it to be. And then we also know that of this percentage, 39% of those who had a mental health condition had a co-occurring substance misuse condition as well. And then those who had a mental health condition, 18% also had a substance misuse condition. And for adolescents, it's even higher. So we know that co-occurring conditions occur. They're very prevalent, and there's a lot of reasons for that. In my particular situation with my family member, my son started basically self-medicating when he was a young teen because his mental health condition was not properly treated or identified when he was younger. And so what happens is then you end up with two issues. You end up with both a mental health mental health condition as well as a substance misuse condition. So, so these are very real things to be considering, especially during this period of time. Could I have the next slide, please? So some of the things that we've been concerned about under the co-occurring condition label are folks who do have a substance misuse condition. And the reason for that is because I've worked in the past with college students like yourselves and on many of the prevention committees at UCSD, and I actually am a graduate of SDSU. And so some of the things that we worked with students was we said, you know, don't use alone, don't leave your friends. If you're at a party, make sure that you stay together. And so now during COVID, we're being told the opposite. We're being told to isolate. And so for someone with a substance misuse condition, this could be the worst advice ever. So we are seeing an increase in mortality because of overdoses. We're seeing people being not attending or going to their therapies because the recovery community has been closed off to them. And we're seeing decreased access to treatment. And we're actually seeing an increase in marginalization because of stigma. And so, so all of these are contributing factors during COVID. And so we have some really overlapping concerns with both the COVID epidemic as well as the opioid epidemic in particular. And so next slide, please. So some of the things that we're doing to help with the co-occurring condition issue is seeking, we're having telehealth appointments, which you've heard about, extended prescriptions for those that are on MAT, medication-assisted treatment, and being able to access those medications without daily dosing. So those are all really great things. And then also many of our support groups have gone online. And even at NAMI, we've transferred all of our support groups that we have for our mental health as well as our co-occurring condition support groups have all gone online. So I want to talk to you a little bit about resiliency right now. So there's a definition up there on the screen: adaptive characteristics of an individual to cope with and recover from adversity. And so the reason I talk about this is because resiliency can mitigate long-term physical and psychological outcomes after a natural disaster. And most of us are fairly resilient and can recover from that. But this crisis has presented some very unique challenges, and I'm watching the news probably more than I should, but I'm seeing lots of folks who we really look up to and who are very resilient, what I would call very resilient individuals, really struggling. And I know Michael Phelps was all over the news a few days ago with his struggles with dealing with COVID. And I wanted to just bring up some examples for things that can happen as a result. I mean, it's a real paradox because it's kind of the best of times and the worst of times all at the same time. So if we go back into history, we know that during the plagues of the 1600s, Shakespeare was in isolation, and he penned some of his most famous plays during that period of time. Isaac Newton was stuck at home when he developed the theory of gravity, and Henry David Thoreau actually self-quarantined for 2 years in the woods in Massachusetts and wrote his masterpiece, Walden. So there are lots of things that can come out of our resilience during a natural disaster. And I mentioned that it was a paradox, and I love Carl Jung's definition of paradox. He said, paradox does more justice to the unknowable than clarity does. And so just really important to remember that although we might be grieving the loss of community, COVID cannot cut off your spirit. It can't take away your hope, and it can't take away your ability to encourage each other. So I'm going to turn it back over to Suzette to talk a little bit about our resources that we have at NAMI.
Thank you so much, Karen. We're wrapping it up, and I have just a couple resources I'd like to share with you. Go ahead and advance to the next slide, please. If you find the local NAMI, just Google it or look it up in the phone book if there's still those things, you will find resources, you'll find support groups, you'll find classes. Since everybody's doing stuff online, you can attend across the country. So that is something I suggest. We have a couple of apps for people in San Diego County. Oscar will get you to an emergency psychiatric place. If you're having an emergency, it tells you what to do. We've got a helpline. That's our website. If you get to our calendar, you'll find all of our online support. And go ahead and skip to the next slide. Okay, go one more. There we go. I'm sorry, go forward. One more and one more. There we go. Support Group Central, which was the last slide. This is an online support group location that has, if you go back just one slide, at the very top, Support Group Central provides free online support for a number of topics. It's not just mental health. It's free. It's fairly easy to navigate. Anybody who is providing support or running groups on this website have been vetted by their clinical psychologists that own this site. And it's a very, very good resource. And that's for anybody all over the country. Survivors of suicide loss is also a very important resource. There are several warm lines. This particular one is available towards the latter part of the day, and you can always get a live person. So there's a lot of resources. You connect to a NAMI, you will find many of them. I want to end there because we went a little bit over, and I know that there are some questions, so I am going to step back and turn this back over.
Thank you so much to all of our panelists for this extremely important and useful information. I really do appreciate your time. As a reminder to our attendees, use the Q&A feature at the bottom of your screen to ask any questions. There are already a number of questions. So I'm going to start us off with one that is general, and then there are a couple specific ones to some of our speakers. So one of the ones that's general was, what can I do to deal with this real deep feeling of depression that has refused to go away? And I've tried everything possible to be free from it, but I just can't. Any suggestion to our participant?
I'll say something about that. I think that, yeah, feelings of grief, depression, loss are quite pervasive. And so what we want to be doing is coping in the ways that we know work, and then developing new ways of coping. But also, I think it's a really good time to reach out and get professional help. And hopefully that is something that can happen in your home because of teletherapy and things like that. And so, yeah, knowing sort of when to get that help is very important. Thank you.
I would also like people to know that NAMI runs peer support groups. They're called Connection. They're signature programs, so they're done the same way anywhere in the country. And it's an hour and a half facilitated by peers with lived experience who've been trained to facilitate. But it's simply a support group. And if you're feeling, wow, this depression is like, I've never seen this before and it's not going away, yeah, what are my coping skills? Maybe you want to talk to someone else who's living with a mental health condition and trying to figure it out. And that can be really, really helpful as well.
Thank you. So the alternate question, or a related question, but from the other side's perspective. So another question came in asking, so how do I speak with my loved ones who are telling me I'm sick, I'm depressed, help me?
Do you want to start with that, Dr. Jennifer?
I thought you two would
Okay.
I would be happy to. So we get calls like that an awful lot, and when we were in an office, we got walk-ins, people coming very, very, very distressed, and sometimes it's not their loved one asking for help, it's their loved one needing help and not asking for it. And you start like you would with any kind of a condition that you're concerned about. You want to go to your doctor, you want to have an appointment, you want to make sure that they're safe, you want to make sure that whatever it is that's going on for them, you find out about that and figure out what it actually is. So educate, educate, educate. And then family support is also incredibly important. And we have family support groups. We've got one every Saturday. And that's for people who have loved ones who have a mental health condition. It doesn't matter what's going on. It's for the family member, and it helps bolster and support them. So I think you can come at it from many, many different directions. We see that to be the most successful.
Yeah, and I would just add to that our resources. So as an individual with a family member who has lots of issues, I'm constantly looking for new resources. So here in San Diego, we have a utility line 211, and they also have a website. So depending on what part of the country you're in, you may have something similar. You can also look for the local NAMI affiliate in your area, and NAMI National, which is in Virginia, will also give you some resources. So I just think it's really important to track down those resources, because there's lots to consider when you're trying to get someone help. There's insurance, cost, there's, location, what kind of resource is best for them, what the diagnoses might be. I mean, it's a very complicated route that you have to take and go down that road. So, knowledge and information is power. And so just putting that tool belt on with all those resources is really important.
Thank you both. Dr. Riker, the question directed at you specifically, how do you see the double stress for people with limited basic necessity and psychological stress due to COVID-19?
I think it's very challenging. And so I think each compounds each other, and it's so important to get the basic needs met, and so that we can focus on our mental health and our coping in general and get sort of back to a solid baseline of a place to even start. So.
Thank you.
Well, one of the things that I just want to add is there are some social institutions that are considered essential and still open. We run a clubhouse downtown on 16th Street, and the clubhouse is for people who have serious mental illness and are experiencing homelessness. So that's a really important question, because we have a whole population of folks who have so many challenges on top of this, and getting them to the right resources is important.
Great. So what are some public health approaches that we can take to address mental health at a population level, especially with the rise of mental health in certain populations with this pandemic, such as healthcare workers and essential workers in general?
So I think the stigma reduction campaigns are so powerful and so important, and people normalizing that we are all experiencing something. And so I really like some of the videos that are being put out by celebrities and athletes and things about it's okay not to be okay, and sort of normalizing that. And so what we want to do as well is normalize help seeking. And so it's okay to get help, both from friends, peers, and also professionals. And we really have seen a tremendous reduction in stigma with the younger generation. That's been wonderful. And so a lot of times we have been talking about pre-COVID, a mental health crisis, but maybe it's just much more out in the open, and maybe we're seeing demand rise for mental health services because people are more okay with getting help. And so I think that's a positive spin on that that's been termed a crisis.
Really positive spin, Dr. Riker. Thank you for mentioning that. And also I would say, if you are any type of activist minded, which your generation is, and I'm so happy to see that, work on the policy issues in your state, in your location, in your locale. Go talk to your public health officers in your community, your city council reps, your supervisors, your county boards, and get involved so that this issue is funded and there is more help available, because that's the way we're going to even normalize it more, is if we have help available and we have funding for those services.
We're getting multiple questions about how to handle this COVID-19 mental health consequences that we're seeing in co-occurring with issues of substance use. Any comments?
So I'd like to take a stab at that one, because I'm very deeply embedded in this issue right now. And so, and it's a tough one, because so many of the services have been cut back or even discontinued. I've heard in some states where law enforcement was actually instructed to not administer Narcan, which is the overdose rescue medication, for fear of contracting COVID. So it's really been an issue and been a problem. And here again, these are things that we need to bring to our county representatives. There's been some emergency legislation passed in many states. Now I know in California, I know our law is the best. So in California, what they've done is they've made it so that new starts for substance misuse, particularly opioid misuse, can be done through telehealth. They've also increased take-home packs. So in the past, medication-assisted treatment was maybe administered daily. So now that has changed, and folks can take home packs. They've had new starts through the emergency departments. There are some programs where if you go to an ER, they can immediately start you on treatment. So there are lots of things. You'll need to check your states and see what the regulations are, but the telehealth part is a huge one, and I would really encourage you to get an appointment there.
Great, thank you. A question for Suzette. You mentioned how lowering our expectations for others with a mental health condition can do wonders for our relationship with them and our own stress. What about those with mental health conditions that have high expectations of themselves? How do you help them lower their own expectations of themselves? You're muted again.
Mute now. Okay, here I am. That's the battle. That really is the battle. What we think that we should be doing or feeling, and what's actually happening and what we're actually feeling. Lowering expectations for ourselves is really important as well. And I liken it to, there's a lot of things going on right now, and there's a lot of things that are coming at me, and the only way I can make sense of it actually is to figure out what's killing me. Like, I can deal with things in the order that they're killing me. That's honestly how I do it. And then when I try and get some balance, just lowering my expectations, because I can't do this, that, and the other thing and take care of that person and make sure I meet this assignment and do this kind of activist thing. And it's just not possible. And I think people who live with mental health conditions, particularly younger people who have grown up with multiple platforms of communication and multiple expectations to save the planet, right? The expectations that our younger generation puts on themselves are incredibly stressful, incredibly stressful. And then when you layer on maybe depression or anxiety or any other condition, you have a mixture for an explosion. So lowering expectations, it is not a bad thing. I was raised that you have to have high expectations, because if you don't, you're going to fail. And what I've found to be true is the absolute opposite. If I lower my expectations, we're all happier and we actually get to a better place. I hope that makes sense.
Yeah, and if I could just add, I think that connects well to what I was suggesting about self-compassion. And, you know, there's research on self-compassion that says it helps with procrastination, it helps with productivity. And so really thinking about and prioritizing our self-care, and I know that term is used a lot, but is there a way that you care for yourself very well? So for example, if you get a cold, are you good at taking care of yourself with that? You could sort of, if so, you could draw from another area and kind of layer that on what's happening right now, because you are in need of more compassion, more social support, more self-care, and more gentle ways of being with yourself right now. If you think about it, I mean, this is a time that none of us has ever seen unless we're 102. Now's the time. Now is the time to do those things. And I think you will reap the benefits.
Thank you. I want to take one last question because I think it's a really important one, and direct it again at you, Dr. Reichert. The anxieties that people are feeling about loved ones that are in nursing homes or ones that are dying without the ability to say goodbye right now. There's been a lot of stress around that, obviously.
It is, yeah, it's one of the cruel features of this time is that we aren't able to get together and support each other in our normal ways. And not only that, but we are missing some of our most important rituals in our society. We know what to do when someone passes, and it's just been sort of taken away from us. And so what do we do with our grief? Where do we put it? How do we handle it? How do we process it? Is something that we're all trying to figure out. And, you know, our society has very few rituals, and the ones that we have are incredibly important. And so how do you allow yourself to grieve, share that experience? And, you know, if you think back to when Kobe Bryant died, people flocked to the Staples Center, and that was actually helpful for people to be among a lot of people that had the same grief going on. And so how do we come together, tell stories about the person, talk about the person, share our feelings, laugh together, because that happens as well. You know, how do we do that now? And there's no way that I could say, well, this is how you do it, but it does require a creativity and a coming together to figure this out. And it may be just sort of writing cards and writing letters and sending them in the snail mail. And that means a lot, both to you and the recipient right now. Mail is one of the most exciting things right now. And so, you know, really trying to be creative and also just honor your feelings, the grief about the person, but also the situation and the loss around the situation. It's valid.
Thank you so much to all of our panelists. Thank you, Jen, Suzette, and Karen, for your time, your expertise, and sharing it with all of us. Again, this webinar has been recorded and will be available online soon. As you close out of your session, please take a moment to complete a brief survey of the session. Zoom will display it on your web browser. This concludes today's webinar. Thank you all for joining us and for your attention.